lot of regulations, a lot of laws involved. And freshmen haven't had pharmacy law yet, that's sequence. Okay, there'll be a good amount of questions on your final exam, but most especially on. So this is a sample prescription, and this is the information of the doctor. Andrew Smith, MD. The doctor's information should have his or her clinic or office address, not the home address. Okay, should have contact information as well. Next one, a prescription should always have the date. So this is date part. A date should always have month, day, and year. If it doesn't have the year, it's not a valid prescription. Because there are rules pertaining to dispensing prescriptions. Is that clear? This was part of the question on the PTC. One thing you should never do in the pharmacy is assume. Never ever assume that that is a milligrams, written in milligrams. That mg looking like an mg is milligrams when the doctor meant microgram. There are rules, regulations we set in place so that we can minimize medication errors. And this is what we're going to be talking about in the next couple of days. Never ever assume. So if it doesn't have a date, don't assume that it's written the current year. It's not a valid prescription. Because a prescription may look brand new. However, it was written last. Okay. There are rules pertaining to prescriptions as to how long is this prescription valid from the time the doctor wrote it. That clear? So this one. And then here comes your patient. Patient's name, patient's date of birth. Usually you don't see that on a prescription that is given to the doctor. Okay. And then the doctor puts the information, or the pharmacist asks date of birth or asks for your insurance card, all that information. This address is important, but not all prescriptions will have the patient's address. Okay. This is the patient's address.